let's just say you suffer a stroke tomorrow. You go to the doctor and they go, you know what, going forward, we're gonna have to monitor your heart a little bit more closely. But had there been data that preceded you from going to the hospital in the first place?
You mean like a historical record for you
Yeah.
that can then be used to recognize something odd, some anomaly?
That's right.
Yeah.
I mean, our cars have more sensors than we do on our bodies. And we're driving down the road and we know if we have a temperature issue, there's like, low fuel, tire pressure, there's sensors all over the car. And we know to pull off the road before your car, has a catastrophic event.
Prognostic
But we're
sensors.
basically walking down the street and there's nothing telling us check body light, that I should be going in to see the doctor to see something that could have been prevented had I known it's coming.
I wonder about establishing baselines of normality, and so to me that suggests that one of the data aspects of IoT is a means to aggregate data across populations, across individuals, so that you can start to understand what represents normal health.
Right.
And therefore, when you can spot something that is anomalous.
Yeah.
So that, it seems to me, that's a challenge that IoT will have, is how do you get all that data aggregated and in a form that you can use to understand baselines? I worry that doctors are always short on time, too many patients, they have to process the patients quickly, and so they don't necessarily have the precision that they would like to have. And I think this is where AI in healthcare could help them.
I think just we're now in our early days of we'll look back on this day in 20 years and go, can you believe we just walked into the doctor and said, hey, I got this chest pain? They'd wonder where your data is, and you're walking around without any data
And it was
collection.
a 7-minute session with the doctor, and he came up with a quick recommendation without necessarily looking at a lot of data.
Yeah, and so it's the data-driven decisions in healthcare is going to be totally transformative.
Yeah.